Nasogastric Intubation Part 1 Indications for Nasogastric Intubation Procedure Description of the indication for Nasogastric Intubation Procedure What is nasogastric tube? Nasogastric tube or NG tube, a tube that is passed through the nose and down through the nasopharynx and esophagus into the stomach. An NG tube can also be used to put substances into the stomach, and so it may be used to place nutrients directly into the stomach when a patient cannot take food or drink by mouth. What is nasogastric intubation? Nasogastric intubation refers to a medical process involving the insertion of a soft plastic nasogastric tube or NG tube through a patient's nostril, past the pharynx, and down the esophagus into a patient's stomach. Indications for nasogastric intubation procedure. First, diagnosis and treatment in gastrointestinal hemorrhage. Second, gastric lavage, irrigation for administration of oral toxic agent. Third, feeding food or medication. And finally, decompression of the gastrointestinal tract. Contraindication to the procedure. 1. Loss of cough and gag reflex, ability to swallow. 2. Causative or hydrocarbon agent administration. 3. Base of skull injury or severe facial bone fracture. 4. Recent nasal surgery. 5. Coagulation abnormality. 6. Corrosive ingestion. Part 2. Equipment for the procedure. Procedure. Explanation of the necessary medical items for nasogastric intubation procedure. 1. Disposable glove. 2. Nasogastric tube number 14 for feeding and number 16 for decompression. 3. 50 ml irrigation syringe. 4. Kidney bowl or kidney dish. 5. KY jelly lubricant. 6. Gauze. 7. Micropore. 8. Scissors. 9. Stethoscope. Part 3. Implementation. Demonstration of the nasogastric intubation procedure. Assessment. An assessment before beginning the procedure. Thirdly, orders check. Check the medical treatment order, including types and size of NG tube, name, surname of the patient, indication for NG tube insertion. Secondly, patient's check. Review the patient's medical history of basilar skull fracture, nosebleeds, oral and facial surgery, facial trauma, nasal septum deviation, past history of aspiration, anticoagulation therapy, or coagulopathy. Thirdly, knowledge check. Assess the knowledge and understanding of the patient regarding the NG intubation. And finally, ability check, assess patient's emotional state, coughing ability, and gag reflex function. Implementation, demonstration of the procedure. 1. Inform the patient. Introduce name and status of the service provider. Give an indication of the procedure and ask the patient permission. 2. Patient's recheck. Check for any abnormalities or obstruction in the nostril by taking a history and physical examination with a flashlight. 3. Prevent infection. Wash the hands with soap or alcohol gel to prevent the spread of germs. 4. Protect yourself. Wear masks and glasses. In the case of evaluating, the patient may have cough or diffuse secretions. 5. Prepare all necessary equipment for the operation. 6. Close the patient bed curtain. 7. Position the patient with supine position and head of bed elevate at least 45 degrees or Fowler position. 8. Squeeze the lubricant over the gauze appropriately. 9. Wear clean latex gloves. 10. Measure the length of the nasogastric tube from the nose tip to the earlobe and from the earlobe to the xiphoid process, and then mark it so that the NG tube ends in the stomach. 11. Lubricate the end of the NG tube with lubricant length of about 2 to 4 inches to reduce the friction between the NG tube and the nasal membrane, resulting in more easily inserting the NG tube. 12. Ask the patient to lift the chin up a little. Then slowly insert the end of the NG tube through the nostril in the natural curve of the neck. When the NG tube reaches the neck, then ask the patient to bend the head down and help swallow the NG tube. Along with the nurse gently pushes the NG tube gently to the marked position. Because of swallowing makes the epiglottis close, allowing the NG tube to pass easily through the oropharynx. 13. Temporarily attach the NG tube. 14. Check the position of the nasogastric tube. Ask the patient to open their mouth and check whether or not the NG tube is curled up in the mouth. Connect the end of the nasogastric tube to the syringe to get the liquid out. See if it looks like food scrap. Then test with litmus paper. If the pH value is less than or equal 5.5, then the tip of NG tube is in the stomach. In case of no food particles are coming out, push the 20 to 30 milliliter of air into the nasogastric tube. Pass through the saline quickly, and listen to the sound of the wind at the epigastric area with a stethoscope. 15. Fasten the NG tube with adhesive strip or micropore to prevent the NG tube from disconnecting. 16. Position the patient in a comfortable position. 17. Take off the gloves. Dispose of equipment. Then wash your hands thoroughly. 18. Make a nursing record regarding type of NG tube used, characteristic of liquid suction. Evaluation. First, assess any irritation after the NG tube insertion. Second, ask if patient feels uncomfortable. Third, observe patient for any difficulty in breathing, coughing, or gagging. Fourth, auscultate lung sounds. Fifth, confirm X-ray film result. And finally, routinely check the location of the NG tube as well as the color and characteristic of the content from the stomach. Caution. 1. In the event of the patient has a cough or rash while inserting the NG tube to the nose into the stomach, which may occur due to pushing the tube too fast or too slow, nurse must stop pushing the tube and wait until the patient's condition is better, and then begins to insert it again. Sometimes it may be necessary to pull the tube out slightly. And finally, in the case of choking, frequent coughing, or difficulty in breathing while inserting the NG tube through the nose into the stomach, it means the NG tube is inserted into the trachea. In this case, nurse must quickly pull the tube out and wait until the patient's condition improves, and then begin to insert the tube again. Nursing care. 1. Take care of the NG tube, not to let slip or change its position. 2. Take care of the tube to prevent pressure ulcers around the nose. 3. Look after hygiene of the mouth and teeth to help keep the oral mucosa moisturized and resistant to germs. 4. Clean with a cotton swab or a cloth dampened in the nostril, including the sticky plaster that is attached to the nose. And finally, assess water and electrolyte balance by evaluating the water intake and output. Complications. Thirdly, direct trauma. For example, esophageal perforation. Secondly, nasolateral necrosis due to fixing the NG tube too tight. Thirdly, nasogastric tube syndrome. Nasogastric tube syndrome is the occurrence of an infection in the larynx due to prolonged insertion of the nasogastric tube, causing the cricoarytenoid muscles to stop working. The vocal cord lose their abduction function, resulting in unable to speak or difficulty